Hello, class. Hope everyone's having a good week so far and getting ready for the holidays that are quickly approaching. I'm actually going to be presenting today on EMR and healthcare transformation. My first presentation, I didn't get the video to work, so now you get to put face to my name. I am Charles Blanchard, and I wanted to go ahead and get started off by defining what EMR is, although I'm sure we all know what that means at this point in the program, as we've been definitely exposed to the term many times previously. But it is essentially a digital version of a paper chart that contains all of the patient's medical records from a given practice. And the EMR is predominantly used for diagnosis and treatment for given patients' presented symptoms or conditions. At the time that I actually read the article, I was surprised to read that the paper records are predominantly stored, or records are predominantly stored via paper still at the time of the article, which was back in 2005. So I'm sure things have changed some here now in 2016, but I still probably heavily paper formatted. It actually creates issues in terms of the ability to coordinate care, measure quality, and actually reduce medical errors. So with the information going forward, I just want to go ahead and state that the article that I read is based off of kind of projections, but it's not actually based off of given data, just because of the fact that back at the time that the article was written, it was still a fairly new process. So wasn't a lot of data to go based off of. So it's all kind of more analytical and projection based. So moving into the costs of EMR adoption, this is probably going to be the biggest kicker for any organization that's considering adopting EMR, and can be oftentimes off-putting. But we'll discuss that later in the presentation. But it's showing, based off of the article, approximately $98 billion to increase the utilization of EMR at the time of the article in 2005 from 20% to 90% of hospitals with EMR current at that time. So also taking into account that same percentage of 20% to 90% of physicians, it would approximately cost $17.2 billion. Sounds like a pretty significant amount of money, and just keeping in mind this is actually over the course of a 10 to 15 year period of adoption, and it includes the upfront costs of implementation and ongoing maintenance of each annual or software and hardware updates. Annually, it breaks down to approximately $6.5 billion for hospitals and $1.1 billion for physicians annually over the course of the 10 to 15 year adoption period. So with that said, thinking about the costs, you probably are wondering what the benefits of having such a costly program or EMR system in place, as there are very significant healthcare savings. It reduces medical errors, which is important for patient care, and improving quality of care. So I'm going to go ahead and break down little different benefits for each different section, starting with potential health benefits of EMR. If you break it down into short-term and long-term, you'll be able to see a little bit more in depth on how this can be beneficial for the patient. Speaking of short-term preventive care, we actually probably more familiar with the ACA and preventive guidelines that were put into place a few years ago, and how more prominent it is in patients being exposed to getting and more involved in the actual preventive care that they receive based off of recommendations from their physicians. So EMR implementation could essentially integrate evidence-based recommendations for screening exams using patient data such as age, sex, and family history. Taking this into account, it could result in 13,000 years of life that could be gained from just cervical cancer screenings alone. So if there's more preventive EMR is in place, it actually will provide alerts and reminders for the physician based off of given data, and actually encouraging patients to have these preventive exams and thus resulting in longer life. So studies actually show, based off the article, that having more involvement or recommendations from their physician to have these type of screenings done, they are more likely to get them done, an increase of approximately 50%, and actually follow through. Moving into chronic disease, it actually shows that 15 chronic conditions account for more than 50% increase in healthcare spending between 1987 and 2000. So, of course, that data capture is quite old, but just imagining how much is actually being spent between 2000 and 2016, I'm sure that it actually would be even more of an increase. Having EMR in place, it actually would provide predictive algorithms, condition-specific encounter templates, remote monitoring, and case management. So, of course, this again is actually applicable to potential health benefits for the patient and better quality of care. Moving into potential safety benefits, as mentioned a few moments ago, there's the alerts and reminders, CPOE, enabling physicians to have real-time warnings for potential drug interactions. And this is important as the article expresses how many drug interactions could be avoided and the cost of each impact for both inpatient and ambulatory level. So looking at the inpatient, CPOE could save $1 billion per year by eliminating estimated 200,000 adverse drug events installed in all hospitals. So, of course, it's a large feat to overcome or attain, and actually getting this fully installed across all hospitals. But thinking about the benefits not only for the hospital in terms of costs and savings, but also for the patient care, it's definitely important to have implemented sooner than later. At an ambulatory level, it actually would help save approximately 8 million outpatient events, or prevent 8 million outpatient events that occur annually, of which a third of them are proposed to be preventable. Thinking about solo practitioners, they actually make up approximately 37% of error and 30% of savings and error avoidance that could be achieved through CPOE. Potential efficiency savings actually include reducing the length of hospital stays, administrative time, drug use in hospitals, and drug radiology used in an outpatient setting, ultimately resulting in approximately $77 billion a year. I'm sure these numbers are probably sounding larger, but as larger than perceived, but actually the healthcare industry spends trillions, if not more, dollars a year. So putting that into perspective, it's still quite significant savings that could be achieved. As previously mentioned, there actually was minimal data to reference when actually proposing the article that was provided. So it's important to actually try to gather data or reference other industries who have actually gone through the process or have been investing in healthcare, or not healthcare, but information technology, which was actually, the article references telecommunications, security trading, merchandising, and retail, who actually really invested in the 90s in information technology, resulting in barcoding and efficiency tools that resulted in cost savings. So based off the data that they found in the other industries, they saw annually 6 to 8% growth. And if we take that same ideology of how much was saved in their industries and cut that in half and referencing 1.5% growth annually on the low end to 4% growth on the higher end, and mapping that over to the potential efficiency savings and cost savings and other benefits with the implementation of EMR, you'll actually be able to see that it could result in 346 billion to 813 billion dollars in savings. A lot of this is not going to be something that's going to be realized up front. It actually will take time to see those savings, and thus the implementation or adoption period going from 10 to 15 years. And the article actually expresses an actual savings that could be rerouted or long-term received on the side of Medicare, approximately $23 billion, or even on the payers end of $31 billion. A lot of these savings, or approximately 2/3 of the savings, could actually be as a result of care that's actually provided to patients that are 65 and over, as they typically incur the most significant or have the most chronic conditions with congestive heart failure or COPD or diabetes, etc. So moving on into the barriers of EMR, as they are very prominent in the implementation or adoption of EMR, since we've already discussed the costs and benefits. Looking at the barriers, it's important to look at acquisition and implementation costs. A lot of times organizations will experience delaying the adoption of EMR due simply because of the cost of not being feasible and not necessarily having resources or support internally. They're a smaller organization, not having the appropriate staff. But ultimately, a lot of times it boils down to the cost and having uncertainty with the rewards or the savings that can ultimately result. You'll also see that organizations are concerned with disruption of workflow, since, as you know, healthcare does not take a break. It continues every holiday and every day of the year. So having the system up and running is of utmost importance to patient care, and it also expands to present privacy concerns. So many providers or organizations experience concerns with privacy, and there's going to be more interoperability with the implementation of EMR, and thus more facets in which patient information can be accessed and it's shared more frequently. Looking at the certification and standardization of EMR, that can be concerned if an organization doesn't have the appropriate support or appropriate professionals on staff to ensure that everything is remaining up to code and within up to date with certain regulations that apply with EMR. And ultimately, a lot of times there's an investment on the provider's end or the physician's end, and ultimately they don't necessarily directly get all of the benefits. A lot of times it's the patient's care, of course, which is most important, but a lot of times the payers actually result in the more significant savings, or as mentioned before, Medicare. So the actual providers or physicians may experience a little bit smaller impact on the savings, and thus might be a little bit discouraging in moving forward with the adoption of EMR. So now you're probably wondering the way forward and how do you overcome those barriers. So I just wanted to briefly mention that it is going to require substantial investments in EMR. It's unavoidable in terms of the costs, but the way that it can be reduced is having some type of government policy or involvement helping overcome the barrier of the cost, especially for smaller organizations. It's going to require a team or institution that really pushes forward the change and interoperability so that it can actually be implemented successfully, and having the robust information exchange networks or infrastructure to support future demands. So I have provided the references there, and I hope you enjoyed the presentation, and hope you have a wonderful week. Bye-bye.